All right. Hello, everyone. Thank you for joining us today. We are at the health department with Dr. Ashley Millham. Thank you for being here with us.
Thanks for having me.
So today we're going to talk about misinformation. There's a lot of stuff out there about COVID-19. But first, before we get started, I would really love if you could go over any of the new research that's been published this week and new guidance that we have.
Yeah, so thanks. I think that's a great place to start. You know, as we've talked about from the beginning of this, there's just a ton of information coming out constantly, lots of new data in a whole host of fields related to COVID-19 and this particular coronavirus. And so some of the things that have been bigger updates this week are that the CDC came out with a few new guidelines. And so one of those is that is how they view close contacts for someone who has a confirmed COVID-19 illness. And so we now, based on this week's CDC update, close contacts are considered people who have been in close contact up to 48 hours prior to that person's symptom onset. So, you know, before we talked about there was recognition that people could transmit this virus prior to their symptoms starting, but that's the smaller amount than how contagious they are while they have symptoms. So this guidance is really good to help make sure we are able to connect with the people who could have been exposed. Again, even though it's a smaller risk, it's still a risk nonetheless. And so it's good that that is being addressed. And so here at our health department, I'm sure other local public health agencies are doing the same. We've been going backwards to make sure that people who had possibly been exposed prior to this update, that they are not missing out on that window. And so we've been connecting with people who have this illness in Boone County and then reaching out to any additional people that they would have been in contact with 48 hours prior to their symptom onset. But this is different than it was prior to this week when this new guidance came out. And so I wanted to make sure people are aware of that and aware that we are addressing that. And so if you're worried that you were a close contact now with this particular evidence, then you would have been contacted already this week by our health department nurses here and our communicable disease staff. Also, they've updated, so I made a couple notes because there was a few updates that came out. Before, whenever we talked about prolonged contact, that's, close contact being less than 6 feet for a prolonged period of time, they really actually gave a number to that. That's more than 10 or more than 30 minutes. And so if you were around someone in closer quarters, but it was less than 10 minutes, they feel the CDC still says that would not be considered an elevated risk of exposure. So that was helpful to kind of have a specific number on that. Additionally, they came out with some travel updates because all countries are experiencing community transmission. And so all travel is really being looked at as a risk factor right now, which again kind of points to what we've been talking about. Please avoid non-essential travel and be as smart and safe as you can if travel is essential for you. The other thing CDC came out and said is, since we do see community transmission now, that people should be alert for symptoms, even if you've not been contacted by a health department, that you were a close contact to someone with a confirmed case. We know that it's in a lot of communities now. And so if you have symptoms of fever and cough or shortness of breath, those would be things that you'd want to be talking to your healthcare provider about if they're significant at all. Again, mild symptoms, you can self-isolate at home, but if you're having more significant symptoms, still reach out, even if you don't have a known exposure, was kind of their point with that. And then I just wanted to do a little update with our case counts, which again are updated. Our communications team is doing a fantastic job of trying to keep our community as updated as possible. So is it still twice a day, Ashton, that you guys are updating that?
Yes.
So twice a day, they update the number of cases that have been identified in Boone County. That's currently at 69. 38 of those are active and 30 have recovered. And then as far as the total number of people tested in our Boone County area, we don't have a way to know the exact number, but we certainly are our larger healthcare institutions here, the university and Boone Hospital Center, have been really great about publishing their numbers of tests that they've done. And so combined, they've done 3,546 tests. And so I think that's maybe a helpful number for people in our community to be aware of as well.
Yeah, that's all great information. Thanks for sharing that with us. So now we're going to get into the misconceptions or different information that's out there that people are kind of wondering if it's true or not. Before we get started with these questions, though, I just want to reiterate that all of our guidance is from CDC, but we are also constantly keeping up with the latest research since this is a new virus. We're still learning, but we make sure those research studies are vetted and evidence-based before we share anything with you. All right, so a common thing going around this week, because we did see a little bit of a slower increase in cases, and then Wednesday, I believe it was, there were no new cases reported. So does this mean that the stay-at-home order is working, and is it time to relax restrictions?
So it's a little too early to say, is my honest answer to that. So it could be that the stay-at-home order is being reflected in that. I hope that that's the case. The stay-at-home order, we know from other communities, will make a difference. It's early enough in the COVID-19 pandemic in our region, so it's early enough in our particular community that we are not able to pinpoint the exact reason for that. I would say it's not due to a lack of testing, because again, over 3,000 people have been tested. But I think that it's just really early to say why that is necessarily. It's also definitely too early to say that we can relax the social distancing guidance, because that's not based on information in our community. Again, it would be too early to say that, but based on what we see in other communities, it looks like at least 10 to 14 days of a decline in cases would be necessary before relaxing that request or those kind of guidelines, to make sure that we didn't see a rebound or a resurgence after relaxing those.
Yeah, and you kind of got into it just a little bit there, but there's a lot going around right now about the peak and what that means. And so if you could kind of explain how to know when we've reached the peak, and then what to expect after we have.
Yeah, so, and that's, there's a lot of people actually around the state. So every healthcare institution, every local public health agency, every health department at every level, including local and state and higher up, all of these organizations have emergency planning people who plan for this type of event all the time. And so they help make sure that the community is as prepared as possible, even if the rest of the community isn't aware that those things are going on kind of behind the scenes, even when there's not a pandemic here. And so those people are really good at looking at models. So I think right now, the one most people are using is out of Harvard, but there's a lot of like WashU and Seattle. There's a lot of other places that kind of create these models for how a community can predict when their peak would hit. It is a prediction. It's certainly not a fact until it's been here. But right now, it looks like the peak here would be probably mid to late May. And again, that as information, as we gain information, both about this particular illness, how it's working in other communities, but also on how it's looking here in our community over the next few weeks, that particular date may change. It's just being reevaluated based on those models on an ongoing basis from people who this is their area of expertise. This is their job full time, even whenever there's not a pandemic, is to be capable of making these kinds of predictions and plans as well as they can, given the data at hand. So that peak could change, but right now that's what they're predicting. And it won't be until it gets closer to that point that we would have more information on what that's going to look like.
Yeah. Okay, so there's also been some things out there about different tests to know if you have the antibodies to fight COVID-19. And there's some questions on if it's true that if you've already had or think you've had COVID-19, that you're immune to it now. What do you know about that?
That's a really good point. And so we know that with a lot of viruses, we can get some amount of immunity afterwards. There's viruses like chickenpox where we can build excellent immunity that protects us in the long run. And then there's illnesses like influenza or the common cold where maybe we develop some antibodies and we develop what we call transient immunity, where for a shorter duration of time, we are immune to it, but that is absolutely not long-standing for some of these other illnesses. The best kind of the best prediction right now, so we don't know for sure about COVID-19, but it does not appear to give you long-standing immunity like something like chickenpox. It appears that it may, after you've had the illness, you may get some short-term immunity, but we do not know how long that is. We don't know if that's a couple of days, if it's a couple of weeks, or something else. And so that is yet to be determined. So I would say if you've had the illness, I would not recommend relying on immunity because we just don't know enough about that particular piece of this illness.
Yeah. So a common misconception that's been out there for a couple weeks now, but it's just that the coronavirus is comparable to the seasonal flu. What would you say to people who think that?
So there are some differences. So maybe, the similarity between influenza and COVID-19 illnesses is that they are primarily lower respiratory infections. So that fever and cough being your predominant symptoms, not as often with the runny nose or eye symptoms. It's not that those are impossible to see when you have those illnesses, but they are predominantly the lower respiratory tract, so that cough and fever being the predominant symptoms. That's the similarity between the two illnesses. COVID-19 illness appears to be significantly more contagious and more serious as far as how many people get seriously ill from it and how many people die from this particular illness. Also, people who get critically ill, who get seriously ill from this particular illness, it lasts longer. And so that's one of the huge reasons for people talking about the flattening the curve in relationship to COVID-19 in particular, is that if you've got someone who's critically ill and needing an ICU space or a ventilator for weeks instead of a couple days, like maybe if they had influenza, then you need to have not as many people getting infected, not as many people getting sick in order to be able to provide that level of care for the duration that the patient needs it. So the duration of the illness is actually another huge difference, is that the COVID-19 illness can last longer, especially for those more serious cases. Also with influenza, we tend to see the illness, if it's going to get severe, it gets severe more quickly, or people tend to, I think the classic thing I hear from patients with influenza is that they feel like they got hit by a bus. Like it's just all of a sudden, the illness hits them really, just really acutely, kind of all of a sudden. And then with COVID-19, you can have milder symptoms at first. And again, 80% of the time, they're going to stay in that mild to moderate range, not requiring significant medical attention. But for the other 20% who get more serious symptoms, they don't necessarily happen at the beginning. And so if you've had symptoms for a few days with this particular illness, you still really have to be alert for those signs of more serious illness, which are that shortness of breath, certainly if it's getting worse, and then also chest pain. So those two symptoms in particular are the big alert symptoms that you need to be getting immediate medical attention if you have COVID-19, even if you've had it for a week. And we still want to be alert for those things developing because of that difference in just we call it that clinical course, the way the illness can kind of continue when you have it.
Yeah. Someone commented that they've seen a lot of people kind of confuse other respiratory illnesses with COVID-19. Do a lot of those symptoms with flu apply to that, or is it different symptoms you should look out for?
The symptoms can be really similar with influenza and COVID-19. It's really the nature of the virus being more contagious and more serious, and that duration of illness. Those are the biggest differences, in my opinion, with influenza and COVID-19.
Would that be the same with other respiratory illnesses as
Oh,
well?
thank you. I'm sorry. I kind of missed your question, didn't I, Ashton? They usually other respiratory illnesses. So when we think of sinus infections or the common cold, or allergies, or strep throat, these other kind of illnesses, those are upper respiratory or upper airway symptoms. So you can kind of think of your upper airway as kind of from here up. So if it's limited to sore throat or swollen glands or sinus pain or pressure or congestion, runny nose, eye symptoms, if it's limited, kind of you can think of if your symptoms are limited from here up, then that would be considered predominantly an upper respiratory infection. And so that would be a big difference. If you don't have cough and you don't have fever and you don't have any shortness of breath, that would make this particular illness less likely.
Yeah. There was a lot of stuff in the news. It might have been a week or two ago now. I know my days are blurring together. But is it true that ibuprofen makes COVID-19 symptoms worse?
That's a great point. So initially there was data coming out suggesting that ibuprofen and naproxen type of medicines, we call these NSAID type of medications that you can get over the counter as pain relievers or fever reducers. Initially data suggested that those made COVID-19 illness worse. Outcomes were worse for people who had those. Then more recently, there's been some literature coming out suggesting the opposite, so maybe not the opposite. I don't think that there's literature saying that they improve outcomes, but there's definitely literature coming out saying that they don't worsen outcomes like we initially thought. So my opinion is that the jury is still out. So the literature that is saying that across the board, so we know that certain people have gotten really sick and that those people have had ibuprofen or naproxen. The question is, did they get more sick because of having one of those two medications? And so there was a lot of speculation at first that yes, they got more sick because of those. And then again, this newer data saying that doesn't really seem to be that cause-effect relationship. They just were kind of two things that happened with this individual, but not necessarily a cause-effect relationship between them. It's early enough on that I do not feel confident that won't swing one way or the other. So I would say, depending on which resource you look at, you can get guidance to avoid them, or you can get guidance that says, no, it's totally fine. I think it's pretty early on. So if you are feeling like you need that particular medicine, you're feeling like you either can't take the Tylenol, the acetaminophen type of medicine, or that's not sufficient for you, then I'd say you probably want to talk with your healthcare provider, one, to make sure that you don't have another reason that you can't take those medicines. But then two, to have a conversation of what's kind of that risk benefit ratio for you. So my opinion is that the jury is still out on that. Although I know the more accurate appearing data right now does not necessarily support those initial studies that this really drastically worsened people's illnesses.
Yeah. Are there any specific medicines to prevent or treat the new COVID-19 or just COVID-19?
Yeah, no, that's okay. There are not. So there are a lot of medications being studied and being trialed, but there is not conclusive data that one particular medicine or that a particular medicine is helpful to the virus itself. There's absolutely medications that can treat the symptoms. So that's where you hear or you may read about supportive treatment. So those are medicines that help with someone's symptoms or helps support their body while their body fights off the virus, but specific medications that attack this particular virus specifically, there's not conclusive data to support a particular medicine for that. Hopefully that will be soon, but it's not there right now.
Yeah. We're going to stick with the theme of different treatments and prevention techniques that are out there floating around on the internet. One being that sunlight or high temperatures can prevent COVID-19.
Yeah, so there is not evidence of that. So please do not rely on that to prevent a COVID-19 illness or infection.
I have a feeling your answer will be the same for a couple of these, but being able to hold your breath for 10 seconds or more without coughing or feeling discomfort means you won't get coronavirus or any other lung disease.
That is not true. I will just leave that one. That's
yeah.
Not true.
And then that drinking alcohol can protect you against COVID-19.
Also not true. So using at least 60% alcohol in your hand sanitizer, if it's in your hand sanitizer that's being applied topically, if you're using ethanol for that, that will kill the virus topically, or over 70% of your traditional alcohol-based hand sanitizer. But as far as ingesting alcohol, that is not shown to help fight or prevent this infection, and certainly has other health consequences.
Another one was, can ultraviolet disinfection lamps kill the coronavirus?
Yeah, that's a really good question. And I think this probably is getting brought up maybe more and more as we see healthcare institutions. Some of them have a particular medical grade technology that uses ultraviolet. I don't even know, I'm trying to think of a non-super technical term for it, but there's some ultraviolet technology that can kill the virus that is specifically designed for this. General UV rays that you or I are going to have access to out in the community are not shown to kill this virus. These are really specific tools that only some healthcare institutions even have access to for mask decontamination of this particular virus. But again, that's a really specific tool specifically designed for this. So in general, we cannot say that UV would kill this virus in general.
I think now is a really good time to remind everyone what can prevent the spread of COVID-19.
Absolutely. So we cannot reiterate this enough. And even though I'm sure people are getting bored with hearing the same messages, they still apply. And that is really diligent hand washing. I've noticed myself already, I've touched my face, I think, twice during this. And so I am working on this as well, but don't touch your face or your mouth or your eyes as much as possible. If you catch yourself doing it, then washing your hands or using hand sanitizer if you don't have access to soap and water at the time would be a really wise thing to do. And then the social distancing, that's 6 feet apart, avoiding coming into direct contact with someone's secretions. Those things really, really make the biggest difference at preventing you from contracting this infection.
Yeah. And I think a common misconception too is that as long as you're not physically touching another person, you're okay. But if we can kind of go into more detail about why even passing things back and forth is risky and things like that.
Absolutely. So it is a new virus that we don't know all the details to, but it still appears that it's likely it remains viable, at least for a certain period of time on physical objects that were even a pen or a pencil, or sharing papers back and forth, or putting your hands on something that someone else touched. You can come into contact with the virus that way. And then also that coughing, sneezing, if you're close enough, maybe even talking, those droplets can get exchanged. And since we know that this is not airborne, but this is droplet transmitted, meaning that those secretions are what carry that virus that can infect another person, that's where that 6 feet comes in really importantly, and not touching the same things as other people, which is really hard to do, which is why there's something like a stay-at-home order. That's based on evidence of what has been helpful in other communities to mitigate, to prevent the spread of this, to slow the spread. And our goal is, of course, to eventually stop that spread. But initially, we have to slow the spread of that virus to decrease how many people get infected and ultimately how many people get really seriously ill from it.
Of course, there's a lot of misconceptions out there too about how this gets spread. One I've seen a lot on social media is about 5G and that is causing it or causing symptoms at least.
Yeah, so that is not accurate, and I think that there's a lot of new stuff in our world. And so when we see a new virus, even if it's a biologic virus and not a tech virus, I think that it's natural for some people to wonder if these things are correlated. Is some new technology feature causing this? But if you read about the biologic kind of the scientific level of this virus, then I think it can make more sense to be able to really put that misconception to rest, that there would not be overlap here between a technology carrying a biologic virus that you can see under a microscope of sorts.
Yeah. Another misconception out there about the spread is that children cannot get COVID-19.
Yeah, so that's not true. We know that young people and healthy people are less likely to get seriously ill from COVID-19 than someone who has certain medical conditions or who is older. That doesn't mean that young people and healthy people can't get the illness. It also doesn't mean that they can't spread that virus, even if they get just really mild symptoms from it. And that's a big part that we all really do have a role in protecting the other members of our community, not just ourselves and our families, but the other more vulnerable people in our community are relying on even the people who are young and healthy to help not let this virus spread through our community quickly, because we know that will result in a certain percentage of people getting very seriously ill.
Yeah. I know we've talked about this before, but face masks, how protective are they? I know the White House said they might be putting out new guidance soon, but let's talk about what's currently out there.
Sure. The current guidelines state that if you are sick, if you have fever, cough, those kinds of symptoms, then please wear a mask if you're going to be around anyone else, or you're going to be around something that someone else is going to be touching, so that you don't get potentially infected secretions that you could transfer to somebody else, that you don't share those. So if you are sick with COVID-19 type of symptoms, then wearing a mask is helpful. If you do not have symptoms, the current guidelines are not to wear a mask. Especially if you are thinking about wearing masks that healthcare providers who are interacting with someone who are sick in a really close way, those are really needed in that circumstance. So there are certain settings in healthcare settings where the masks are recommended when you're caring for someone with this type of illness. And so if you are not in that setting and you don't have symptoms, until we have an abundance of those masks, it would be very kind of you towards your other community members that are on the front lines here to not use up that type of personal protective equipment from them.
Yeah. And then we also had someone comment, they've heard of some people experiencing a form of pink eye or conjunctivitis. I'm not sure if I'm pronouncing that correctly. Symptoms with COVID-19. What have you heard about? Obviously, we know the three main ones of fever, cough, that sort of thing. What else is out there?
Yeah, so There's a lot of people report kind of a variety of symptoms. Usually with COVID-19, you've got the cough or the fever on top of those additional symptoms, though, is kind of the key point. So some people have allergies that cause red or itchy eyes or watery eyes or runny nose or sneezing. And so, or you may get a cold that causes some of those symptoms or a different viral infection that causes those symptoms. That does not preclude you from getting the COVID-19 infection. So you can have more than one thing, but if your symptoms are isolated to a runny nose or to sneezing or to those eye symptoms, and those are the only symptoms you have, then COVID-19 would be much less likely.
Well, thank you so much for joining us today. I believe that is all the questions we have right now. I want to encourage everyone to still follow us on social media. Our website has a lot of links to different resources that a lot of times will debunk a lot of this information or give you more details about what you see online. So be sure to check in with that. And then, as always, you can always message us and we will do our best to get you the correct information. Thanks so much, Dr. Millham, and we will see you again.
Thanks for having me.
Thanks.
Sounds good. Thanks, guys.